Now the next speaker is Dr. Praneeth Telukanta. Dr. Praneeth.
Good morning, everyone. I will be presenting on diffuse choroidal hemangioma, clinical presentation and treatment outcomes. So, we all know that choroidal hemangioma, characterized as vascular hematomatous tumor, present in two distinct forms based on the extent of the choroidal involvement, that is circumscribed or diffuse. And diffuse choroidal hemangioma, we see that it is most commonly seen in conjunction with Sturge-Weber syndrome. The fundus findings varies from either loss of choroidal markings to exudative retinal detachment with choroidal thickening, and it is also associated with secondary glaucoma. So before proceeding with my study, I would like to show about a single case. So this is the clinical picture of a 12-year-old female patient who presented to us with complaints of diminution of vision in the right eye since the last 3 months. So like even on the external examination, we see that the characteristic port wine stain involving all three branches of the trigeminal nerve. And on the top right image, we see there is exudative retinal detachment, and also you see that tomato red appearance under that. That also suggests like goes in favor of choroidal hemangioma. So in the bottom right image, it is the B-scan ultrasound. We see medium to high intensity echo in the mid-vitreous cavity that is suggestive of a retinal detachment, and posterior to that you see a globular mass that is homogeneous and mid to high intensity echoes suggestive of this diffuse choroidal hemangioma. So she underwent external beam radiotherapy, and we see in the serial fundus photographs that there is resolution of both the exudative retinal detachment and also the diffuse choroidal hemangioma. So the aim of this study was to describe clinical characteristics and treatment outcomes of patients diagnosed with diffuse choroidal hemangioma and Sturge-Weber syndrome. So this was a retrospective study and recruited patients who presented to the clinic in between October 2012 to March 2022, and patients with diagnosis of diffuse choroidal hemangioma were included. And the diagnosis was based on the results of clinical examination, B-scan ultrasound and optical coherence tomography. The demography, treatment details and functional outcomes in the form of visual acuity and intraocular pressure, and anatomical outcomes in the form of resolution of the retinal detachment and reduction in the tumor height were noted. So 32 eyes of 29 patients were included in the study, and 15 eyes involved were right, and 18% of the patients had bilateral involvement. So the main presenting features were blurred vision that was seen in 84% of the patients, and facial discoloration in 15% of the patients. There was dilated and tortuous episcleral veins that was seen in 37.5% of the patients, and port wine stain was present in 75% of the patients, and 56% of the patients presented with exudative retinal detachment. So there are even in the diffuse choroidal hemangioma, 4 of the patients presented with a focal nodularity. The baseline mean tumor height of the patients was 4.9 millimeters, and the mean largest basal diameter was 10.7 millimeters. So the patients underwent either radiation or non-radiation therapy. So in radiation therapy, they underwent external beam radiotherapy and plaque brachytherapy, in which ruthenium plaque was used. And this flowchart shows the functional outcomes. We see that the visual acuity actually decreased from 1.09 to 1.39. And in these patients who underwent this radiation therapy, 25% of the patients needed TRAP and 16% patients needed AGMs due to the secondary glaucoma. And those who underwent other therapies like transpupillary thermotherapy and orbital propranolol, again the vision was dropped, but we see that the number of complications, like patients who needed TRAB and TSCPC, that is due to secondary glaucoma, were more. So in the anatomical outcomes, there is a reduction in the mean tumor height of 5.76 to 5.53 in the external beam radiotherapy, and 3.17 to 3 millimeter in the plaque brachytherapy. And in the other treatment group, it was 3.35 to 2.14 millimeter. So this study describes the clinical features of patients with diffuse choroidal hemangioma and the treatment outcomes with different modalities that they underwent. The demographics, presenting visual symptoms, and clinical and imaging features were consistent with those described in the other studies in literature. So a mean follow-up was 94 months, and complete regression was seen in 37% of the patients, and partial regression was seen in 12% of the patients. So on an average, the tumor thickness was reduced to 2.85 and no significant change in the best corrected visual acuity as I had mentioned earlier. The mean apex radiation dose was 40 gray, which was similar to previous studies. However, the mean dose reported in literature was 50 gray. So the limitations being a retrospective study and small sample size, and few of our patients had a missing imaging modality. To conclude, I would say that it is a rare intraocular tumor, and despite good tumor control and better anatomical outcomes, we see that the vision remains poor. So one thing that we need to take home from here is that we need to look for other features like CNS involvements and also for secondary glaucoma. Thank you.
Okay. So what is your aim?
My aim was to describe the clinical characteristics and the treatment outcomes of different modalities that were used in this study.
So all cases are of this Sturge-Weber syndrome?
Not all cases were of Sturge-Weber syndrome. So of the 32 eyes, 29 eyes were of Sturge-Weber syndrome.
And the other two? And the remaining?
That was not completely fitting into the criteria of Sturge-Weber syndrome.
Okay, but they had diffuse choroidal hemangiomas.
Yes, they had diffuse choroidal.
Okay. And the other interesting thing was your use of propranolol. So which were the selected cases where you used propranolol, and what was the outcome?
Doctor, actually the use of propranolol, it was not recent. It was the cases, as I mentioned earlier, we have included cases from 2012 to 2022. So the cases that were treated earlier, they were given propranolol. So in cases that were given propranolol, they were given a dose of 40 milligrams BD for 6 months.
Okay.
There was a reduction in the tumor height, but they had complications of secondary glaucoma, and more patients required trabeculectomy, and one patient actually required TSCPC.
Among the patients who were treated with propranolol, yes. Was there any reduction in the exudative detachment, or that persisted with them?
There was partial regression. It was partial, not complete.
It was not complete regression.
Yes.
Thank you.
Thank you.